What if one blood test could warn you years in advance about upcoming healthcare disaster? Prediabetes might sound like a pre-problem, but don't be fooled. It is a big red flag. This condition means possibly you already have insulin resistance and you're getting all the harmful consequences of metabolic syndrome. This condition is a big deal. That means it is already raising havoc on your organs. In fact, more than 1 in 3 adults and around 98 million Americans, and over 80% of them have no idea. We talk about COVID, it is a bigger but silent epidemic. Left unchecked, those slightly elevated blood sugar will snowball into type 2 diabetes. Prediabetes is your early warning sign. Ignore it at your peril. We will break down why prediabetes is a big deal. What if one blood test could warn you years in advance about upcoming healthcare disaster? Sneaky signs and symptoms to watch for. The key lab tests and numbers you need to know. The very real damage and cost that begins before diabetes strike. And importantly, practical tips to stop prediabetes in its track. Stay tuned because this information could save your life and wallet. Prediabetes means your blood sugar is higher than normal, but not high enough to be diagnosed, to be labeled as type 2 diabetes mellitus. Think of it as a yellow light before the red light of diabetes. Doctors diagnose prediabetes using fasting blood sugar between 100 to 125, oral glucose tolerance test of 140 to 199, hemoglobin A1C 5.7 to 6.4. If your numbers fall in this range, you have prediabetes. This means your body isn't handling sugar properly. How common it is? Extremely common. CDC estimates 1 in 3 Americans have prediabetes. You can feel fine with prediabetes. There are no obvious signs and symptoms. It flies under radar, and you often find out by your routine blood test if you go for your routine age-appropriate preventive care. And since many people skip annual checkups, this means the warning signs will not be known and you could develop diabetes and complications. Over 80% of the people with prediabetes are unaware. That is millions of people with a ticking bomb and no clue real diabetes. So do I really need to worry? I think we should worry more about prediabetes, because if you have diabetes, you will be treated, you will be protected. Prediabetes pretty much stays under radar. You develop insulin resistance and you get complications. In prediabetes, your sugar lingers in your bloodstream longer. It damages your blood vessels and organs. The experts agree prediabetes is not benign. It's doing harm right now, years before diabetes develop. Diabetes is a tip of the iceberg. Damage is happening now. Research shows complications can begin in pre-diabetic stage. One study found kidney damage occurred even years before diabetes is diagnosed. Others show early signs of nerve damage, eye damage in prediabetes. High insulin levels and sugar spikes injure your blood vessels and nerves. As prediabetes greatly increases the risk of serious disease. By definition, it puts you on the road to develop type 2 diabetes. Up to 70% of people with prediabetes will develop diabetes mellitus in their lifetime. Because people are unaware, they don't give proper credence. Medical community does not focus time and energy to educate people, and patients or general public do not want to act till they have symptoms. But even before diabetes develop, pre-diabetics are at high risk to develop heart attack and stroke. CDC warns people with pre-diabetes face high risk of developing heart attack and stroke. In 2021 study shows pre-diabetes nearly double the risk of cardiovascular event, and all-cause mortality was high over the period of 5 years. This is a big deal. It increases the risk of heart attack without even having diabetes. Pre-diabetes often coexists with metabolic syndrome. That means you have high blood pressure, unhealthy cholesterol, belly fat. They damage you silently. Don't ignore it. Pre-diabetes is a wake-up call. Your metabolism is under stress. You ignore it, your risk will increase. You will develop diabetes, leading to blindness, kidney disease, nerve damage, amputation, heart attacks, stroke. Don't ignore pre-diabetes. It is your chance to prevent those outcomes. Most people feel no different. Very rarely they have side effects. Signs get ignored or attributed to something else. Common signs to watch for include is increased thirst, frequent urination, fatigue and sluggishness, blurred vision, tingling or numbness in hand and feet, slow wound healing, dark, velvety skin patches under neck, arm, groin. These are often mild, easy to miss for aging or stress, but they are major red flag signs. Many people have no symptoms. That's why blood testing is crucial. Don't ignore annual physicals. 3 main tests can diagnose prediabetes. Fasting blood sugar between 100 to 125. Hemoglobin A1C 5.7 to 6.4. Oral glucose tolerance test showing blood sugar between 140 to 199. Any one of these in that range equals prediabetes. Some experts urge to do fasting insulin level because insulin resistance starts a year before blood sugar rise. Higher fasting insulin can predict diabetes decades in advance. Most doctors will not do insulin levels routinely, and if you already have type 2 diabetes mellitus, I do not believe it contributes much. It should be tested early in the game. Know your numbers. If you are over 45, overweight, or you have family history, get tested. Pre-diabetes is just a health risk. It is a big economic burden. Diabetes can double your medical cost. Frequent hospitalization, lab testing, glucose monitorings, medications, and complications, eye care, foot care, the cost can skyrocket. Medical bills are number one reason for bankruptcy in the United States. Nationally, it's staggering. In 2017, elevated blood sugar, which means diabetes plus prediabetes, costed United States $404 billion, out of which $44 billion were spent to treat and prevent prediabetes. I believe we should spend more on prediabetes than diabetes. We could prevent 58% of it if patients are cognizant and healthcare system supports them. It is a big deal. It's very hard on healthcare system and it will bankrupt you. Good news is prediabetes can be reversed. You could turn back before it gets into diabetes. Here is what you should do. Lose weight, a modest weight of 5 to 7%. Meaning, if you are 200 pounds, losing about 14 pounds of weight and never gaining it back, combined with proper diet, you could cut the risk of developing diabetes by 58%. Cut sugar, refined carbohydrates, soda, white bread, cakes, cookies, pasta, and processed carbohydrates. Eat vegetables, lean proteins, healthy fat, fiber. Develop a healthy lifestyle of eating. If you do not fix your eating pattern long term, you are bound to fail. People who have gone through multiple surgeries and they have taken different kind of weight loss drugs and programs. They all gain back because they revert back to their bad habits. Fix your eating pattern forever. Avoid grazing. Do intermittent fasting. In Asian wisdom, especially in northern India, if you are less than 50, eat 3 meals. Above 50, only 2 meals. Above 75, only 1 meal. Now science is proving that intermittent fasting is helping. Exercise every day. Aim to get 150 minutes of exercise per week, which is about 30 minutes 5 days a week, preferably 7 days. Walking counts. Add strength training twice a week. Muscles improve insulin sensitivity. Even short walks after meals can soak up those spikes in sugar. Manage your stress. Stress hormone increase your sugar. Manage to get sleep 7 to 9 hours. If you have any sleep disorders like sleep apnea, get tested, get treated. Join diabetes prevention program. We have a free program in our office. Join it. Work with dietitian, team up with a friend. Accountability boosts success. Recheck labs every 6 to 12 months. Celebrate small improvements. If numbers are getting worse in spite of lifestyle changes, consider medications. Metformin has been tested for many years to be used in prediabetes. Lifestyle plus pharmacological treatment. I have patients who have lowered their A1C, lowered their fasting blood sugar, lost their weight, and reversed their diabetes. Beauty is they will never see those complications which we have been talking about. And yes, you can reverse prediabetes. Prediabetes is a major issue. It means your body is already under stress, but it is your second chance. Take it seriously. Do not panic. If you haven't been tested, get tested. If you have been told you have prediabetes, do not ignore. Start with 1 to 2 small changes today. Swap soda for water. Take 20-minute walk after dinner. Schedule nutrition consult. Share this video with family and friends. 8 in 10 people with prediabetes do not know they have it. You could save someone's life by sharing this information. Give this video a thumbs up and subscribe to our channel Kundlas MD. Prediabetes is your warning sign, but also your chance to change. The road is here. Take the turn towards healthier you. You got this, and we are here to support you. I will see you in next video. This is Dr. Kulmeet Kundlas signing off. Thank you.